Behavioral health disorders, including mental illness and substance use disorders, affect all of our communities. It doesn't pay attention to race or religion or socioeconomic status. We have a behavioral health crisis in this state and in this country. And the pandemic has exacerbated the situation with skyrocketing overdoses and suicides. Hi, I'm Representative Roger Goodman, and in this Good Minute, we're going to talk about addressing the behavioral health crisis. I talk to many people in our communities, and I hear the same recurring themes. The top priorities are to make sure we have good public schools, concern about the cost of living, and the behavioral health crisis. In the legislature, one of our top priorities is also the behavioral health crisis. It's been in the middle of our radar screen for quite a while. We have a long way to go, a long road back from a generation of neglect. The behavioral health crisis is everywhere, in our streets, in the jails, in the hospitals, and too much quiet suffering with families at home. In my role as chair of the House Public Safety Committee in the legislature, I've been working for many years to decriminalize mental illness and substance use disorder. Too many people are arrested and jailed and traumatized when they actually need therapeutic care instead. Last year, the state Supreme Court invalidated the drug possession statute, and the legislature stepped in with a new approach. The war on drugs clearly hasn't worked. Instead of punishment, we need healing and treatment and recovery. We are now building up a system to connect people with case managers, stable housing, and the treatment they need to recover with compassion and for support to be successful. We want to give a helping hand rather than handcuffs. This year's budget invests heavily in this vision. Investments include $27 million for expanded opioid response programs and supports, including overdose prevention and harm reduction programs, mobile opioid treatment services, and an opioid awareness campaign to educate youth about the dangers of fentanyl, the most toxic and dangerous opioid drug. $29 million to fund crisis outreach and diversion programs, including what we call the Recovery Navigator program, which provides intensive case management for those suffering acutely from substance use disorder. And also evidence-based training for law enforcement to improve interactions with individuals who are using prohibited drugs. We're also providing millions more dollars for therapeutic courts at the municipal court level and the district court level. Therapeutic courts are more collaborative and less adversarial, where everyone wraps around the defendant who may have committed a crime, but where substance use is the underlying cause. For the behavioral health system in general, we're making more major investments, including $28 million to fund housing and employment for individuals struggling with behavioral health issues, housing stabilization teams that work to stabilize clients' housing in times of crisis, and establishing a program to certify peer specialists as health professionals in the behavioral health space. We're also providing a one-time $100 million appropriation to help behavioral health providers who barely survived the pandemic. We're also providing $51 million to increase rates for mental health and substance use disorder providers, because building an effective mental health and substance use disorder workforce requires paying them adequately and limiting turnover and building capacity. Our two-year biennial budget, including this year's supplemental budget, continues to build out a behavioral health system focusing on treatment and recovery, along with intensive case management and housing. But we have a long way to go. We don't have enough capacity for inpatient beds and other services. We don't have enough trained professionals to provide support to those who are suffering. And we aren't compensating the professional workforce adequately to prevent turnover and burnout. But in the end, I'm confident that everyone in this state will benefit from a system that is more humane and effective. They'll provide more stability for our families and more stability in our communities at large. Thanks very much for your attention, and I'll be back with another Good Minute sometime soon.